Hi, my name is Celine Bonilla and I'm an APRN student attending Purdue University. Before I begin, do I have your verbal consent to conduct this video?
Yes, I consent.
I want to begin with a mental status exam. So first off, can you tell me your name?
Anita,
Your date of birth?
71468
Okay. And why are you here?
for a wellness check.
Great. And you know what time of day it is? Morning, afternoon, evening?
Morning.
Okay, great. Now I'm going to assess your attention by asking you to perform what's called a Series 7. Subtract 7 from 100.
It's negative 93.
Okay. Next, I will be assessing your memory. So please repeat these 3 words. Red,
Red,
book,
book,
clock.
clock.
All right, remember those words. Red, book, clock. Okay, now for abstract thinking. Tell me how oranges and apples relate.
They're both fruits. They're healthy for you. They both have vitamins.
And what's your overall mood today?
Good. A little hot.
Yeah,
The heat has me a little.
it's a hot day for sure.
Yeah.
Your speech is fluent, normal in tone, rate, and articulation. Your thought process is linear and goal directed. No delusions. Are you having any suicidal ideations or thoughts?
No.
Okay. Now assessing judgment. What would you do if you found a stamped address envelope on the ground?
Probably put it, maybe just take it to the post office.
Great. Alright, so now I'm going to perform a neuro exam on you. I'm going to wash my hands with soap and water, and I'm going to put gloves on. Okay. I have a card here. Alright. Put this over your eye. Alright. Close your eye. That one. How many fingers am I holding up?
2,
Switch to the other one. How many fingers am I holding up?
4.
Good. Alright. Let's put the card down. Alright, so your optic nerve is intact, cranial nerve number 2. In terms of ocular motor, follow your eyes with my fingers. Great. I'm gonna just lightly touch your face, lightly touch your cheek. Okay. And you tell me if you feel me or not. Okay.
Yes. Yes.
Good. Now clench your jaw. Alright, release it. Good. Puff out your cheeks. Smile. Raise your eyebrows. Frown. Okay. Good. I'm gonna use a makeshift tuning fork. Okay. A makeshift tuning fork. Alright, you tell me if you hear me, okay?
Yes. Yes.
Is it equal?
Yes.
Okay. Is there anyone that's louder?
No.
Okay. Can you, with my flashlight, stick out your tongue and say ah? Good. Alright, everything appears symmetrical, and there's a symmetrical rise in your soft palate. Can you shrug your shoulders with some pressure? Nice. Can you turn your head other way, against me? Okay, other way. Turn it against me. All right. Stick out your tongue. Say ah.
Ah.
Nice. Say ah.
Ah.
Move it back and forth. All right. Tongue is midline. Looks good. Okay. So let's continue. We're gonna do strength. Squeeze my fingers as hard as you can. Squeeze. Good. All right. Push my hands against yours. Good. push your feet against my hands. Good. Nice. Alright, so your strength is 5 out of 5 in your upper and lower extremities bilaterally. No tremors are noted and no involuntary movements are observed. Now I just want to assess the function of your hands and feet. When I touch your feet lightly, do you feel this?
Yes.
Do you feel this?
Yes.
Do you feel this?
Yes.
Alright. When I touch a little harder, do you feel this?
Yes.
Do you feel this?
Yes.
Do you feel this?
Yes.
Do you feel this? Okay. So I'm going to use my tuning fork on your wrists. Do you feel this?
Yes.
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 Okay. Now I'm going to move your toe and tell me if I'm moving it up or down.
Up. Down.
Good. Next we're going to test your reflexes. So we're going to do bicep first, so that's going to be within your inner elbow. Okay, ready? The other one. Alright. Hang your arm. Hang it. Ready? 1, 2, 3. This is for your tricep. Okay. Was that done? Good. Okay. We're gonna do your kneecap. Ready? 1. Good. Equal reflexes. I'm gonna also do your Achilles tendon and your dorsal foot. So I'm doing your Achilles tendons bilaterally now. And your dorsal foot. Okay, good. Next, I'm gonna stroke the sole of your foot with my tool. I'm just looking for Babinski's reflexes, see if it's negative. So it's gonna be from your sole, Good. All right, it's negative. Now I'll assess your coordination and balance. Touch your fingers with your nose and then touch my finger. Do it twice. 1, 2. Okay. Now run your heel down your shin. Like this. Good job. Okay. Now rapidly turn your hand palm up and palm down. Palm up, palm down, palm up, palm down, palm up, palm down. Okay, now walk. Stand up and walk. And I'm just observing if you have a normal gait. Okay. All right, now you're gonna stand up and put your feet together. And then close your eyes, okay? All right, no swaying was noted. Romberg test was assisted. Next, I'm gonna do a assessment on your abdomen. Are you having any abdominal pain or discomfort?
No.
Okay. Per this video, we're not gonna expose her abdomen, but we would create privacy and we would drape. So we're gonna start with inspection. So I'd be looking at her abdomen and see that there's no visible rashes, there's no visible open areas, there's no edema noted. And then I'll palpate. And then I'm gonna auscultate all 4 regions. All right. Alright, so just relax. I'm just gonna listen to your belly. First, I'm listening to bowel sounds. Now I'm listening for bruits. So I'm going over your aorta and renal arteries. Alright, and I'm just going to percuss. Okay. Right. Okay. Any pain when I touch?
No.
I'm going to do a deep palpation. No masses, no tenderness, right? Alright, I don't feel. I'm attempting to palpate for the liver edge. And it's not palpable, and the spin is not palpable as well. In terms of the breast exam, I'm just going to communicate it with you. I'm not going to do any contact. So I'll just describe it. So a verbal explanation is that you would be supine position with one arm raised behind your head. I would inspect both breasts for symmetry, skin changes, nipple inversion or discharge. Using the pads of my fingers, I palpate each breast in circles, covering all quadrants, and I will assess for any lumps, tenderness, nodules, and then I'll continue to palpate for your axillary lymph nodes, central lateral, subscapular, and pectoral, and for any lymph buildup. In this case, for this video, there's no abnormalities noted on inspection or on palpation. I'm also going to do a GU exam, verbalize it. So for this female patient, I would begin by ensuring privacy using proper draping and lightening. The patient would be in lithomy position with feet in the stirrups. After donning gloves, I would inspect the external genitalia for lesions, swelling, discharge, or any abnormalities. I would use a warm speculum, and I would inspect the vaginal walls and cervix. I would collect necessary specimens, such as pap smears or cultures. Next, I would do a bimanual exam. This would be performed by palpating the uterus and the indexa for size, mobility, and tenderness. If indicated, I'll do a rectovaginal exam, and that would be assessed posterior to the pelvic structures. In this scenario, all the findings are normals, are within defined limits. There's no lesions, there's no discharge, and there's no palpable masses. In conclusion, do you have any questions or concerns on this visit? Is there anything that I can do? Any resources that I can give you? Have you completed follow-ups on your last appointments?
Yes, I had a mammogram done.
Okay, great.
And eye exam as well.
Awesome.
And dentist.
Good.
Yeah.
All right. Well, thank you so much for your participation, and thank you for being a great patient today.
Thank you.